Okay, we are live. Good afternoon, everyone. Today's session is going to be really helpful, and it's led by Dr. Radha from Apollo Cradle and Children's Hospital. She is going to talk about postpartum depression after delivery, symptoms, and treatment about it. So, stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hello, everyone. My name is Dr. Radharao. Thank you so much for the kind introduction. I'm an obstetrician gynecologist at Apollo Cradle, Jayanagar, Bengaluru. And today I will be speaking to you shortly, in a short way, about postnatal depression, the symptoms and the treatment. Postnatal depression is a condition that occurs after delivery, and this is quite a common condition that we see in women. Lot of women after delivery of their baby, they get very excited. They take the baby home, but when we see them in the postnatal visit after 1 week, they're quite low in mood. They're tired because they've been up all night looking after the baby, and they look a bit low. And that's when we get the first a sign that this person may be going through a bit of postnatal blues. But when this continues for 2 weeks, 3 weeks, 4 weeks, and doesn't seem to go away, then we conclude that this must be postnatal depression. And in a few cases, in very very small amount of cases, it may go into a stage called psychosis, when other features can be there. So as I said, postnatal blues, they are very common. Postnatal depression, we've seen a few where this continues, and postnatal psychosis is the very extreme form of it. Now, what is the kind of incidence? Now, when I said most, a lot of women have this, so up to 75 to 80% of women can experience postnatal blues. Now, this is a mood disorder that can happen after delivery because of changes in the body that can happen, like there is a high level of estrogen and progesterone hormones in the body while a woman is pregnant, but once the delivery happens, the levels fall, and the thyroid hormones also fall, and this can cause changes in the woman's body that can make her feel low. Second is sleep deprivation. Sleep, as you know, a newborn baby has no schedule, so a woman can be up all night. That can carry on for 2 3 days, but beyond that, a woman can get exhausted. Third is anxiety, especially for first time mothers. So they are not sure how to look after the baby. They're not sure what to do when the baby cries. So this can cause a lot of anxiety as to what might happen, and what might happen, baby's crying. And, that is the other thing. So all these things can lead to feeling low. So the symptoms of postnatal blues could be a change in appetite, uh, person is not feeling hungry at all, or eating a lot, that also can happen. Then sleep disturbances, a woman is not able to relax. The third is, she might feel that mood suddenly changes, it keeps fluctuating. So a person is crying all the time for no reason. Uh, these are the common symptoms of postnatal blues. So this can happen starting the second day after delivery for up to 10 to 12 days. So it doesn't usually persist beyond 2 weeks, and with good family support, and if there's somebody to look after the baby, and the woman rests for a while, and the hormonal changes also, they get better after 2 weeks, this usually declines and the person feels better. Now, if these changes in behavior and mood persist beyond 2 weeks, uh, that is called postnatal depression. Now, postnatal depression is this persistent feeling of low mood that can carry on beyond 2 weeks, and it can start even a little later than that and persist for weeks or months. Now, this particular condition is quite common. It is seen in 1 in 7 women these days. So the incidence is almost 10 to 15, almost to 20% sometimes. And it can present as low mood, loss of interest in everything, excessive crying, excessive anxiety, and person is not eating properly, is not unable to sleep, and there can be, so woman typically says, I cannot bond with the baby. there is a bit of detachment. um, Certain things make us really notice, and that is when the woman says, I have thoughts of harming myself or the baby. And that is something that triggers us to immediately refer the patient to a psychiatrist for counseling, medication, and support. So in certain cases, when the woman complains of hearing voices or seeing things, like hallucinations, visual or auditory, and delusions, a feeling that something is there, though it is completely irrational. So that is when we think about psychosis. Now, all these symptoms that I listed, there are certain risk factors for these. What are they? So, a person who has had depression in the past as a teenager or an young adult has almost a 30% chance of postnatal depression. So, that is one symptom to be, one past history to be very sure about. That, if a woman has had history of depression in the past, so we have to provide adequate support and early intervention if she's pregnant. And also, this depression can start during pregnancy. If a woman has had low mood during pregnancy, that can persist after delivery. Also, if a woman is very young, like late teen pregnancy, they are at increased risk. And also, if the woman has not been very keen for pregnancy, she's been kind of, it has happened by accident and she's continuing with it. Also, if a woman has had a recent job loss or a health event, and she's particularly stressed, these things can happen. Family history of mood disorders. If there has been history of mood disorders in the woman's family, history of psychiatric illness or mental disorder, such women are at increased risk. Now, having said that, anybody, any woman, even a professional, even a well educated person, coming from a higher socioeconomic class or a lower socioeconomic class, can suffer from postnatal depression. This is a very important point, and this is what I would like to get across to the audience. Anybody can suffer from postnatal depression. Now, once we pick up these cues that a woman is appearing low and she's not able to care for herself or for her baby, there are certain scoring systems that can be used. There are certain leading questions that we can ask, like she's had loss of interest, something that was giving her pleasure in the past is not giving her any pleasure anymore. It could be a hobby, it could be talking to a friend. So that is something that we should look out for. There are some scoring systems like Edinburgh depression scoring scale. There are some questionnaires that a woman can fill. These are available online as well. And so, for a bystander, for a friend, suppose you're a friend of a woman who you think is going through a bit of low mood, what can you do? You can you can offer to look after the baby for a while. The woman can rest. Maybe adequate sleep is something that she needs. You can help with the household chores so that she can relax. You can ask her to seek medical help. That is one important thing that you could do. Now, once a woman has been diagnosed to have this low mood disorder, usually the care after that consists of counseling. So we refer the woman to a psychiatrist to make a diagnosis. And depending on the severity of the problem, a woman can be given medication. And this could be anti anxiety medications, or it could be antidepressants. There are certain group of medications, SSRIs or SNRIs, that can be given safely in pregnancy and after delivery. So even if a woman is breastfeeding, if the depression is moderate to severe, medication will help her. Yes, a small amount can be transmitted to the baby via the breast milk, but safe medications are there and a woman will feel better. The other thing to remember is the medications may take 2-3 weeks to work fully. So, simultaneous with medication, we start counseling. So, there are clinical psychologists that can talk to the woman. There are some support groups as well. So, group therapy also can help, but usually one on one cycling, one to one counseling will help. And CBT, cognitive behavioral therapy, can be used for this. And sometimes talking is the answer. So when women come to me and they appear a little low, not completely depressed, but definitely in the postnatal blues phase, we ask them to talk to friends, talk to your husband, talk to family. That will definitely help, and talking itself can be a therapy in these conditions. So what are the other things that can help? So if a woman is going through this postnatal phase, she's looking after the baby full time, and so she's feeling low. One is ask for help. Always, there is no prize in doing everything by yourself. So household chores can be done by others, because looking after the baby has to be done by you. That is one thing. Second, um, there are good days and bad days. This is something that you have to accept. If you may feel low on one day, whether physically, mentally, emotionally, the next day you can be better. You have to accept this fact. Third, avoid caffeine, alcohol, and other such stimulants. Alcohol to fall asleep or to feel better, that will definitely not help you. This has to be avoided. So the fourth is to take a walk. So it's always better to get exposed to fresh air, to sunlight. So taking a walk early on, even just after a C-section or normal delivery, whether it's in the terrace or the balcony, or going to a walk in the nearby park, if your doctor allows and you're in a condition to do it, is always good for your mental health. Then talking to friends and family, talking to your husband, that is important. As I said, marital discord or a loss of job or some kind of stress can make things worse, and to make this better, talking to friends and family will always help you. So also, you can take out 1 hour a day as your time, and you can use it to pursue a hobby, or for exercise and talking to a friend. This will always help. um, Always speak to your obstetrician, gynecologist, to your doctor. Convey what kind of thoughts you're having, what kind of feelings you're experiencing, whether it's kind of in the normal range, or there's something to worry about, in which case the doctor will refer you to a psychiatrist. And it is definitely not a taboo. As I said, anybody can feel these symptoms, even a professional. I have seen many doctors going through this, and nobody is immune. A person who is going through this phase is having a difficult time. And as a doctor or as a mother or as a friend, if you identify that these symptoms are being experienced, you should refer them for medical care. So I hope this helps. I'm open to taking questions. Are you there? Okay, so if there's any questions, you can put it in the chat and we'll see if we can answer them. I think at present there are no questions. So thanks for the patient hearing. I hope this session has helped you identify women who are in need of medical help, this condition of postnatal depression. Thank you.